Good morning, and thank you all for joining us for this year's Mercy Honors Rise Award celebration. My name is Catherine Anaya, and I am very happy to join you today as your Mistress of Ceremonies. We're also thrilled to have everyone joining us here today, our members and their families, our community of providers, community organizations, and advocates. Today, we celebrate and recognize the 2021 Rise Award honorees and nominees. First, I would like to introduce some very special guests who are joining us today. Janet Walker, the chair of Mercy Care's Board of Directors. Jamie Snyder, she is the Director of Access. Mercy Care Committee and Council members, and members of Mercy Care's leadership team. It is now my great pleasure to introduce Mercy Care's President and CEO, Lori Bottrill.
Good morning, everyone, and welcome. Thank you for being here today. We're excited for this opportunity to honor all the great work that's taken place in our community over the past year, and what a year it's been. It has tested us and tried us in so many ways, and yet our community of members and families, providers and advocates have demonstrated their incredible resilience, an amazing approach to innovation, commitment to serving others, and a true dedication to empowering those around them. Since we gathered for Mercy Honors in 2020, Mercy Care has implemented a new integrated health plan for children in the child welfare system, and we expanded services under our statewide DDD contract to include communication devices. During this pandemic, Mercy Care distributed personal protective equipment, including masks and hand sanitizers, to our providers and tribal communities. We made smart tablets available to our members so they could continue to get healthcare services they need through telehealth. More recently, we have partnered with providers to provide mobile vaccination teams to support our most vulnerable members, including seniors and individuals with intellectual and developmental disabilities. This year has highlighted commitment of our employees, providers, and community partners to put our members at the center of everything we do. This is core to who we are and who we will continue to be. I am so grateful for what we've achieved together. Today, Mercy Care honors and recognizes those who exemplify the best of everything we aspire to be. To all the nominees, congratulations and thank you.
And now, Mercy Care Board of Directors Chair Janet Walker will share a few words with us.
I'm Janet Walker, Chair of the Mercy Care Board of Directors, and I'm honored to be here with you this morning. I am so happy to join you to recognize the nominees and honorees for this year's 8th Annual Rise Awards, and to recognize the resilience, innovation, service, and excellence they deliver to our community. Today, we celebrate all of you and your compassion, innovation, collaboration, and advocacy. We have amazing examples among this year's nominees. A food bank and a corner grocery store who have made a tangible difference in improving food security for some of the most vulnerable people in our communities, especially during COVID and the struggles we've all faced over the last year. A leader who turned a clinic serving people with serious mental illness designations into a high-performing organization, reducing homelessness and improving health outcomes in only 3 years. A police officer who has provided sex trafficking prevention and awareness training to 4,000 people across the state of Arizona. Thank you. Now more than ever, our efforts are truly needed. The work that each of you do is so important. We're grateful for your relentless commitment to improving the health of our communities. On behalf of the Mercy Care Board of Directors, congratulations to all of the RISE nominees and honorees. We truly thank you for helping us to fulfill Mercy Care's vision. Thank you for all that you have done. Back to you, Catherine.
Thank you so much, Janet. We are so grateful for everyone's dedication to improving health and wellness. And now we'd like to turn our attention to Jamie Snyder, the Director of Access.
My name is Jamie Snyder. I serve as the Director at Access. Thank you for joining us for this year's RISE Awards. Congratulations to all of this year's honorees and nominees. The number and quality of nominations again this year continues to show us how much good work is occurring in the community, promoting resilience, innovation, strength, and empowerment. Access's mission is to reach across Arizona to provide comprehensive health care to those in need. Thank you for all you do to help us fulfill our mission. And thank you for being here. Enjoy the show.
Thank you, Jamie. This year, we have a special guest joining us for RISE Awards, Christopher Michael Copolillo. He works as a clinical coordinator for one of Community Bridge's Forensic Assertive Community Treatment, or FACT teams. The message that he's sharing with us today is that recovery is possible.
All right, thank you, Catherine. My name is Christopher Michael, and I was addicted to substances. I would say that I'm in remission today. Over the course of the last 18 years, my life has taken an awful lot of turns. From the time that I was 16 years old, I started out with peer pressure, with smoking weed, and from there it just got worse. At 16 as well, I was introduced both to narcotics and to treatment from my parents. They put me into substance abuse programs, and so I got introduced to community-based 12-step recovery programs then. As time went on, I got worse. Cocaine, heroin, methamphetamine, all of those fun things like popped in. And just to backtrack a little bit to the beginning, or at least towards a little earlier in my life, at 11 years old, I lost my grandparents after moving out to Gilbert, Arizona. 3 of them within a year and a half. So there was a lot of stuff that happened early on, and substances had a profound role in everything that was going on in my life. I was introduced to adult treatment at 19 years old, going to California, and then subsequently, following that was what relapse looked like, and how my ideas of sobriety started to form a little bit. In that, I thought that I could smoke weed and just drink and everything would be okay, and I could be like all of the other people and all that. But there's some predisposition that I have that makes that impossible for me, and I know that from countless times of attempts. The cycle continues for the next 7 years until it's at its head on May 31st of 2013. I'm in my truck at a McDonald's parking lot, and I'm waiting for the dude to show up, and the guy finally shows up, and I'm getting ready fixing my shot, and this lady walks out of this McDonald's. She's got her 2 little kids, and she's walking them into her minivan. And I know that today is going to be the last day that I'm going to use. It's either that I'm going to die today, or I'm going to get sober when something has to happen, because the constant everyday struggle is this going to be the last time? Is this going to be the last time? Is this going to be the last time? And it just goes on forever. I know that every day was very, very painful to try and get through. In some of the pictures that you'll see, it's evident to me of how I was feeling at that time. So I go and I use, of course, and I go to my parents' house, and my parents did not want me around so much anymore at that point, but my mom lets me in, and she says, "What are you going to do?" And I said, "I don't know. I guess go back to detox again." And she stayed awake with me that whole night. And then in the morning, after I started to get the goose flesh and all the fun stuff that comes along with it, and the puking and whatever else, I was on my way back to Community Bridges for detox. And there was a kid that was there who told me that he had some heroin. And again, I had this great resolve to go and get clean or die, and I told him, "No, man, like, I don't want any of that." But the nurse then later says to me, like, "Hey, it's going to be an hour before you get medicated." And the obscene part of substance use and addiction, and whatever you would like to call it, is the fact that even after that great resolve, I'm asking that kid if he's got a needle, and I'm getting high in the bathroom for the last time at Community Bridges on June 1st of 2013. So after that, I talked to that peer support again. I remember crying during that conversation, and and just being ready to do whatever it took. So I followed along and I did that program and I completed that program. And what I wanted at the end of that was to be able to give back the way that that man had given to me. And so I showed up after I graduated that program every day at Community Bridges in a suit and tie to try and show up and get a job as a peer support. It took a little while after that in order to be able to get in the organization, but I finally did. And once I did, I put everything into it. You know, I got to, so much stuff happened after that. I got in a relationship. I got married to her. I grew up in the company that I was working at. Currently, I'm the Fact 2 clinical coordinator at Community Bridges. I had a kid. When I got married, I inherited a kid, bought a house, have vehicles. I don't know, like it's a much different life than I thought I was going to get. The reason that it's important to share this stuff is because after we get through from one side to the other, where it at once seemed impossible to be able to ever cross that bridge, after crossing it, it's reaching a hand back out and saying, come on, we can do this together. And that's why I'm here today. And so I thank everybody for your time, for being here. And I appreciate all of you in this room for your contributions, for what you do for the greater good of the county and of the state. Thank you.
Thank you, Christopher Michael, for that inspiring message of hope. And now it is time. We received so many nominations for the RISE Awards this year. Everyone who was nominated should be proud. Your work is noticed and it is truly appreciated by us and by everyone whose lives you touch. As everyone who is tuning in today knows, it isn't always easy to do this work. And we are so proud to partner with many organizations and individuals who work tirelessly every single day to continue improving services and reaching out to engage those who need those services the most. Let me tell you a bit about the RISE Awards. The RISE Awards honor an individual and a provider in each of three categories: compassion, innovation, and advocacy and collaboration. The recipients of Compassion Award spread a message of hope. They understand the importance of treating the whole person. They help others have a positive outlook on life. They make sure that people who make important decisions about healthcare hear the members' stories. The recipients of the Innovation Award use innovation to improve how members get care. They do this by developing new programs or transforming how healthcare services are delivered. The recipients of the Advocacy and Collaboration Award advocate for improvements in healthcare. They give a voice to people who can't always speak up. They work to raise awareness regarding important health topics. They partner with others to create positive change in the community. This year we had, get this, 93, you heard that right, 93 RISE Award nominees. It's just incredible. So first, in the individual category for compassion, here are all the nominees. And the RISE Award goes to Daniel Morrow, a recovery coach at Southwest Network Saguaro Clinic. Here's part of his nomination. Dan is the epitome of customer service, patience, and recovery-focused interactions with all members. Dan has such an excellent way of engaging with members and getting them to a point of being their own heroes. And now Dan will share a few words with us.
I am truly honored to receive this award. I have to admit, I'm a little speechless, but thank you, Mercy Care, for this amazing award. I'm truly grateful. I know that recovery from mental health challenges, substance use, and other life challenges is not only possible, I believe, and I know that recovery is a reality. People we serve in our behavioral healthcare system can go on to live a better life, to have hope, and even find new meaning and purpose in life. I have the privilege of and strive to help our members find that hope and that meaning and purpose every day. I also want to thank Southwest Network, not only for this nomination, but for the ability to promote recovery in all that I do. I believe recovery environment can be a key predictor in recovery. And I see on a daily basis the evidence that people are recovering here at Southwest Network. So once again, thank you, Mercy Care, for this award. Thank you, Southwest Network, and thank all of you for the amazing work that every one of you do in the lives of the people that we all serve. Thank you.
Congratulations, Dan. And now the provider category for compassion. Take a look at all of the nominees. And the Rise Award goes to Community Bridges Avondale. Here's part of their nomination. The caring and compassion of the staff at Community Bridges Avondale is like 100 pieces of a puzzle put together daily to help patients with their needs. Staff members who use their lived experience to form deep connections with patients can be described with this saying: I love when people that have been through hell walk out of the flames carrying buckets of water for those still consumed by the fire. And now a few remarks from Rayanne Buckingham, accepting the award on behalf of Community Bridges Avondale.
Colleen and I are honored to represent CBI Avondale, which has been selected for a Mercy Care Rise Award in the provider category of compassion. CBI serves individuals with some of the biggest challenges, and the staff never shy away from doing the hard work that is needed to make a difference in someone's life. I think Colleen Mueller, who wrote the nomination, said it best when she wrote, I would be unable to list all of the compassionate staff, as there are many members of our team that go above and beyond for our patients with care and compassion for the individuals that we serve. Sometimes it's the smallest thing that means the most, such as witnessing a staff member kneel down by a patient in a wheelchair to be on their level and talk to them eye to eye instead of bending over them when they speak. When observing our staff interact with our patients, you can see the genuine care on their faces, as well as hear the compassionate and empathetic tone that they use. My coworkers provide not only assistance for our patients, but personal examples as well. More often than not, our staff members have backstories involving addiction, homelessness, and incarceration, and more. In describing our staff, I would use the saying, I love when people that have been through hell walk out of the flames carrying buckets of water for those still consumed by the fire. It's difficult for me to specify a particular instance to describe their compassion. I would more likely describe it as 100 pieces of a puzzle put together daily to help our patients with their multiple needs while teaching them how to help themselves, using kindness, dignity, and respect. I have never worked with a team of people so caring and invested in their job and the population that we serve. On behalf of CBI Avondale team, thank you for this Rise Award in Compassion.
Congratulations to Community Bridges Avondale. And now in the individual category for innovation, once again, here are all the nominees. And the Rise Award goes to April Rhodes, President and CEO of Touchstone Health Services and Spectrum Healthcare Group. From April's nomination, in the midst of a pandemic, April has been laser focused on providing our communities the integrated healthcare they need. Under her innovative guidance, our organization has continued to provide crisis support, primary care, behavioral health services in homes, schools, hotels, offices, jails, hospitals, on the streets, and online. Let's hear a few remarks from April.
Thank you, Mercy Care, for this incredible award. I am so honored and humbled to be receiving an award in innovation, and the RISE Award in particular is very prestigious. So we're incredibly grateful at Spectrum and Touchstone to be receiving this recognition. And I don't even know what to say, but except for that, really any award that I receive on behalf of Touchstone and Spectrum really belongs to the employees and the leadership teams there that help make these things possible and have jumped to do all of the things we needed to do over this past year without hesitation and just really with the intent and heart to serve the communities. And so we're incredibly grateful. This will mean a lot to all of them as well, and it certainly means a lot to me. So thank you, Mercy Care.
Congratulations, April. And now in the provider category for innovation, first, all of our nominees. The RISE Award goes to Native American Connections Integrated Health Team. Here is part of their nomination. Well aware of the health disparities impacting Native American community members, Native American Connections quickly initiated responses to the COVID-19 pandemic. The Integrated Health Clinic implemented a full COVID-19 vaccination clinic, vaccinating everyone from its healthcare providers to high-risk and vulnerable individuals. Let's hear a few words from Native American Connections.
Thank you so much, Catherine. I'm so happy and honored to accept this award on behalf of Native American Connection. My name is Alyssa Payon. I'm the Director of Quality and Compliance. And I want to introduce you, at least virtually, to our integrated clinic team, who is led right now by Jennifer Thompson, putting all the pieces together. She's our Urban Indian Program Specialist. And then our nurses, Wendy Aragaki and Bridget Gassell, Chris Kuhl, Sherry Shumway, and our medical assistants, Navicia Hill and Elias Collado. And our most recent join to the team, Heather Jordan. So all of those team members have worked so hard to vaccinate over 650 people in the last 12 weeks. 360 of those have been fully vaccinated, first and second dose. So we're continuing on our effort. Another really key piece to this was that we had the support of all of the staff in our housing communities and in our residential sites, our congregate care sites, helping to coordinate the effort. So they were literally knocking on doors of people's apartments and asking them if they wanted to be vaccinated, helping prepare the paperwork and the schedule. And the neat part about all of this was really that we were able to kind of bridge what sometimes happens to be a silo. So you have housing and behavioral health, and we really truly came together all as one to support this effort and get behind it. So thank you to everybody that supported this effort at Native American Connections. We couldn't have done it without you, and I'm again honored to accept the award on our behalf.
Congratulations to the Integrated Health Team. And now in the individual category for advocacy and collaboration, let's pause to take a look at all of the nominees. And the RISE Award goes to Andy Arnowitz, the Information and Resources Coordinator at Copa Health. From Andy's nomination, over the past 20 years, Andy has been a tireless advocate for individuals and their families. He receives hundreds of calls each month, and he is relentless in helping people navigate the complexities of the system. He also manages a number of support groups. Andy is a peer who has given back more to the system than he has ever received. Let's now hear a few words from Andy.
I am truly honored and humbled to receive this RISE Award. There are so many great, committed, and passionate colleagues who do such great work. First, I want to thank my parents. Next, along the way, I have been extremely fortunate to have had a couple people that have been of tremendous support. They have also inspired me to keep trying to improve and do my best. One of them is the acclaimed mental health advocate, Chick Arnold, and the other is Dr. Mike Franzak. Mike has been amazing for me, and it was Mike who brought me to Mark Community Resources, which is now Copa Health, led by my CEO, Dr. Sharda Jaffe-Piper, who I am so happy came to Copa. The service I provide is a free public service, and it exists, thankfully, due to Copa Health. As you may know, anyone in or connected to the mental health community can contact me for information and resources. Individuals living with a mental illness, their family, their friends, colleagues, and other professionals can all contact me. It is truly an honor to do what I do and be of assistance to so many people. Thank you very much for this award.
Wonderful work, Andy. Congratulations. Our final honoree in the provider category for advocacy and collaboration, here are all the nominees. And the award goes to St. Luke's Behavioral Health Hospital, specifically to its president, Julie Miller, its intake department, the Observation Services for Children and Adolescents program, and the Child and Adolescent Services units and its supporting departments. A few words from St. Luke's nomination. St. Luke's Behavioral Health Hospital's collaboration with Mercy Care helped create the Human Trafficking Collaborative. They have served over 100 minors who are victims of human trafficking and have worked around the clock to make sure these girls are assessed and given the proper treatment. Let's turn our attention to remarks from Julie.
Thank you to Mercy Care for this award. I'm here with our amazing team today. In 2017, we started working with Mercy Care to help sex-trafficked youth across Arizona. And within the last year, we've seen a huge increase in our population coming through our behavioral health center. With the help of our intake department, our observation program, our inpatient adolescent unit, social services and activity therapy departments, we've been working closely with the police, the FBI, and Mercy Care to help these sex-trafficked youth get the services that they need. We are so grateful to be partnering with Mercy Care and doing this amazing work. And though sometimes it's very difficult for us and we've had to change a lot of our programming, we've had to have a lot of education and training for our staff and our leadership team. We are just so excited about the future of this program and what we're doing across Arizona to help stop sex trafficking. Thank you so much again for the award. We really appreciate it.
Congratulations to St. Luke's Behavioral Health Hospital and all of our RISE Award honorees. And now we'd like to present the RISE Award's Lifetime Achievement Award to a distinguished individual who has had a great impact on expanding Medicaid and improving the lives of Arizonans. Our award recipient this year is former Arizona lawmaker, Senator Kate Brophy-McGee. Senator Brophy-McGee was instrumental to Medicaid expansion and restoring funding for kids' care in Arizona. Her support for restoring funding kids' care following the Great Recession meant healthcare benefits for 30,000 children whose parents made too much money to qualify for access but didn't have employer-sponsored health insurance. She was also a leader in the creation of the Department of Child Safety as a standalone agency, mandating transparency and accountability. Please turn your attention to the video to learn more about the impact Senator Brophy-McGee has had here in Arizona.
Giving of yourself to serve others is a calling that Kate Brophy-McGee has always answered. For a decade, she served in the Arizona State Legislature, where she left a legacy that benefits all Arizonans. While she made a big impact in many areas, her work related to Medicaid and child welfare makes her an outstanding choice for the 2021 Mercy Honors Lifetime Achievement Award.
Kate's legacy in the Arizona legislature is dedicated, perseverant, genial, passionate. I could go on all day. Most importantly, I'd say that Kate was known for her big ideas and her bipartisanship.
In 2012, Senator Brophy McGee played a vital role in Medicaid restoration and expansion, which restored access benefits to 300,000 Arizonans in desperate need of care following the Great Recession. To make this critical legislation happen, she worked across the aisle and joined Democrats in supporting the Medicaid expansion bill.
Kate Brophy McGee will leave an impact on the state legislature and the state of Arizona for many, many years to come. She implemented and took part in so many different dramatic, earth-shaking policy changes.
When I think about Kate, I think about her bipartisan impact. When Governor Brewer and Kate and many of us were working on Medicaid expansion. That was so critical to all of Arizona, and especially to the vulnerable.
The long-term impact of the work that you've done is really that we are looking at programs and care differently, especially for individuals in the Medicaid system. You've really taken an approach that let's advocate, let's work together, and let's really give the right care and in new and different ways that forever will put Arizona as one of the leaders within the Medicaid program.
You know, it's easy to be a Republican and go to the legislature and say, I'm going to cut your taxes. It's not so easy to say, I am going to protect the kids and the people who need our help the most.
Senator Brophy McGee's belief in policy over politics continued in 2014 when she led the effort to create the Department of Child Safety as a standalone agency. As a result, the number of children in foster care decreased by nearly 20%.
She helped develop a safety net for a lot of kids and families that otherwise wouldn't have access to quality health care. And I think Arizona is better for her service in the Arizona legislature.
We're actually moving forward with an integrated plan for individuals in the child welfare system. That advocacy and the focus on improving that system for these vulnerable children really came from Kate.
Although she's no longer in the legislature, Senator Brophy McGee's impact on the health and well-being of all Arizonans will never be forgotten.
Kate's got a wall full of plaques. She has received lots of awards over the years, but I just want you to know that I think this is the award that'll mean the most to her because it really recognizes her for the commitments to kids, to families in need.
Congratulations, Senator, on this much-deserved Lifetime Achievement Award. With 10 years in the legislature and over 30 approved bills, you've earned it.
Kate, I just want to thank you so much for everything you've done. This award only is an example of the wonderful work that you've done, and we're so happy to have this and give this to you today.
I can't think of anyone better than you to receive this award. You have truly been inspirational throughout your political and just general career.
This is an award that it really does recognize everything that you've done for Arizona, and particularly for Arizona's healthcare systems. A lot of folks are in a much better position. A lot of folks are happy and functioning well because of the work that you did.
Kate, our lives are filled with lots of people, and then we are lucky enough to have it filled with some very special people. And in my lifetime, you are that special person.
Kate, you have made a remarkable difference in the lives of so many people. Congratulations and nicely done.
A remarkable legacy of service to all Arizonans. Now let's hear from Senator Kate Brophy McGee herself.
It's been my honor and privilege to stand alongside leaders, great leaders, and talented professionals, and know that our sole focus was caring for these vulnerable populations. They needed a voice, and they needed policies that made it possible for them. If you do what's right, it's going to be okay. I cannot begin to tell you how unprecedented Medicaid restoration and expansion was, how important it was for the state of Arizona. We spend a lot of time in the legislature swatting at symptoms of problems. We never get to the root of those problems. And the DCS transformation was, again, one of the most rewarding and difficult aspects of my work in the legislature. I could not be more proud. Some of those stories of what happened to some of these children who didn't make it to safety will be with me always. But I did my work with the understanding that it would be better for those who followed. I hope I am not done yet, because there is a lot more work we need to do. But if this is the apex of what I accomplish, I am truly, truly blessed.
Once again, congratulations to Senator Kate Brophy-McGee, our Lifetime Achievement Award recipient, for her incredible impact on Arizona children and families. We also want to again congratulate all of our RISE Award nominees and honorees. Thank you all for joining us today. We are very much hoping that next year we'll be able to meet and celebrate in person. But until that time, we encourage everyone to stay safe. We hope you all have a great day.